Hello and welcome to your channel, Well-Being at My Age. I am truly glad to have you here. In this space, we talk about health, longevity, and simple natural habits that help you maintain physical, mental, and emotional balance. In today's video, I want to share something very special with you, something that can transform your day-to-day well-being. Today on Well-Being at My Age, we are going to discuss why that annoying phlegm keeps coming back, mucus in the throat. Imagine this for a moment. You wake up every morning with that uncomfortable sensation, as if a piece of damp cotton were stuck in your throat, or worse, like you swallowed a raw egg that refuses to go down. It's not a random allergy, nor is it one of those quick colds that disappear in a couple of days. And yet, that stubborn mucus stays there, forcing you to clear your throat over and over again, even in the most inconvenient moments. In the elevator, waiting in line at the grocery store, or while talking to someone. Sounds familiar? Most of my patients describe the exact same thing. And when people mention it to others, they usually hear the same response. Oh, it's just phlegm, it's normal at your age. But let me tell you something honestly. My name is Dr. Gabriel Mina, and I assure you that it is not always normal. That mucus that won't go away, that irritates and even affects your voice, has a cause. And it is not something you have to accept as an inevitable part of getting older. Today, I want to help you understand why that phlegm clings to your throat. And more importantly, I will show you how to eliminate it from the root without depending on those colorful syrups that, let's be honest, usually just mask the problem for a short while. Stay with me, because what I'm about to share can deeply improve your well-being. Before we continue, let's clarify something essential. Even if it doesn't sound appealing, you need to understand this. Mucus is not your enemy. In fact, it is one of your strongest allies. Think of it as a security team working non-stop, day and night. Your body produces between 1 and 2 liters of highly sophisticated mucus every single day. To trap everything. From tiny particles floating in the air to viruses and bacteria trying to enter through your nose or throat. It is a protective barrier, a natural lubricant that keeps your airways moist and functioning properly. It is literally your first line of immune defense. So no, the mucus itself is not the real problem. The issue appears when that protective fluid, which should be light and easy to move, becomes thick, accumulates, and turns into a sticky mass that no longer goes up or down. It's like your body has a perfectly functioning highway, until suddenly there is a traffic jam that blocks everything. And of course, as the years go by, when we reach our 50s, 60s, or 70s, the natural movement of fluids becomes less efficient. The muscles that help us swallow without thinking tend to relax. The lymphatic system, which acts as our internal drainage network, may be working at only 70% of its capacity. So any irritant, even a tiny one, gets trapped instead of disappearing unnoticed. This does more than cause discomfort. It is a warning sign, a message that your body's delicate balance needs attention. And before I tell you the main cause behind all of this, the one most people never suspect, allow me to say something important. Many of the people watching this video are not subscribed yet. So if this content is helping you, I invite you to subscribe, activate the notification bell, and share this video so more people can understand what is happening to them. We upload new videos every single day. Now let's continue, because what comes next is the #1 cause of persistent phlegm that almost no one imagines. Even many colleagues do not consider it in their initial evaluations. Let me briefly share a case I attended recently. A 62-year-old woman named Teresa came to my office exhausted from that constant throat discomfort. She told me she avoided speaking during family gatherings because she spent more time clearing her throat than actually talking. Her issue came from the same root cause that I am about to explain today. Once she understood it and we treated it properly, her life changed completely. Have you ever heard of silent reflux? I'm not referring to the typical burning sensation some people feel after a heavy meal or a strong cup of coffee. That is the well-known heartburn of classic gastroesophageal reflux. And yes, it can also cause phlegm, but silent reflux is much more deceptive. Its technical name is laryngopharyngeal reflux, or LPR, and it is a master of disguise. The strange part is that acid can rise during the night, or even while you are awake, without causing the usual burning sensation. because instead of stopping in the esophagus, it travels much higher, reaching the throat, the larynx, and the vocal cords, areas far more sensitive. And since there is no burning, there is no pain. The symptoms appear in completely different ways. A dry morning cough, the urge to clear your throat before your first sip of coffee, and of course, that thick mucus that seems to have moved in permanently. The process, although fascinating, can also be concerning. Let me explain. Your stomach produces pepsin, the enzyme responsible for breaking down food. When acid rises, it carries that pepsin upward. This enzyme reaches the throat's mucosa and settles on the vocal cords. The problem is that whenever it encounters an acidic environment again, the pepsin reactivates and begins to damage the throat's tissue. It is literally like your body begins to attack itself without meaning to. In response to this microscopic aggression, your throat produces excess mucus to protect itself from the acid. It is a natural reaction, but an exaggerated one. To give you an idea, studies from the prestigious Mayo Clinic have found silent reflux in up to 60% of patients who complain of persistent phlegm without typical digestive symptoms. Meaning, most people have no idea that their stomach is behind the problem. So if you notice that you need to clear your throat when bending down to tie your shoes, after eating something spicy, or even after drinking lemon water, the most likely explanation is that reflux is filling your throat with mucus. It is a common condition, but one that often goes unnoticed. And once we identify it, the solution is usually much closer than you think. Now, let's move on to our second cause, another silent culprit, postnasal drip, the one that doesn't hurt either. When people hear the term chronic sinusitis, they usually imagine intense headaches, facial pressure, or severe congestion. However, chronic sinusitis does not always behave this way. In many cases, especially in older adults, the only symptom is mild nighttime nasal congestion. It doesn't completely block your breathing, but just enough to trigger that constant phlegm problem. Let me paint the picture for you. You lie down to sleep, and while you rest deeply, your paranasal sinuses, whether inflamed or producing excess mucus, begin to drain slowly toward the back of your throat. It's like a silent dropper releasing thick mucus right into the vallecula, the small area where the tongue and epiglottis meet. And when you wake up, there it is, that feeling of something stuck, that stubborn phlegm that won't come off, and the need to clear your throat again and again. Many of my older patients, and maybe you as well, assume this is nothing more than a cold that lasted longer than usual. And what do? They go to the pharmacy and buy an over-the-counter antihistamine. But let me be very clear, this is a major mistake. These medications may temporarily dry out your nose, but they also make the remaining mucus thicker and stickier. The end result is even worse. Less mucus, yes, but far thicker, harder to move, and glued to the throat. The solution here is not to dry it out, but to cleanse and thin it. That's why I always explain to my patients that the key is rinsing the sinuses with warm saline solution. It's a simple, inexpensive, and surprisingly effective technique. A bit later, I'll explain exactly how to do it. And in cases where nasal polyps or other structural issues are present, it is essential to evaluate with an ENT specialist whether a nasal corticosteroid is needed. You would be amazed by the power of a well-cared-for nose. Your respiratory health depends largely on it, and therefore so does a phlegm-free throat. Before going on, let me share something brief. A few months ago, I treated a man named Rolando, 68 years old. He was convinced he had a lung problem because he woke up every morning with his throat full of mucus. But the real issue was constant postnasal drip. After teaching him how to properly rinse his sinuses, his symptoms improved by more than 70% in just a few weeks. Sometimes the key is simply identifying the real source. And with that, we reach the third cause, medications that silently affect your throat. Now I want to invite you to reflect on something we often overlook when trying to understand why that persistent phlegm appears. I'm talking about medications. Yes, those pills we take faithfully to stay healthy, and that, paradoxically, can become a major source of throat irritation. Perhaps you take aspirin for heart protection, an antihypertensive such as ACE inhibitors, or a nonsteroidal anti-inflammatory to ease joint or muscle pain. Well, several of these drugs can produce side effects that irritate the sensitive throat lining or even increase the cough reflex and mucus production. Take ACE inhibitors, for example, widely prescribed for blood pressure control. Although excellent for heart protection, they have a well-known side effect. They increase levels of a substance called bradykinin. And in some people, bradykinin is responsible for that persistent dry cough and that annoying little bit of mucus that doesn't come from an infection, but from irritation triggering mucus as a response. And what about anti-inflammatories like ibuprofen or naproxen, commonly used to relieve pain? These medications reduce prostaglandin production. While that's helpful for inflammation, certain prostaglandins protect the stomach lining. When they decrease, anti-inflammatories increase the likelihood of acid reflux, including that silent reflux we discussed earlier. And what happens with more reflux? Exactly, more mucus in the throat, creating a vicious cycle. Let me tell you a very specific case. Not long ago, I treated a patient named Mariella who had been struggling with phlegm that kept her awake at night. After several tests, we discovered the cause wasn't an infection or an allergy. It was her antihypertensive medication. With a small adjustment in her treatment, the phlegm disappeared in less than 2 weeks. Sometimes the solution is simply reviewing the basics. By the way, if this information is helping you, I invite you to subscribe to the channel, activate the notification bell, and share this video. I upload new content every day to help you better understand how to care for your health naturally and consciously. Here's something very important. I'm not telling you to stop your medications. That should never be done without medical supervision. What I am suggesting is that before blaming the weather, age, or bad luck, take a moment to review your medication list with your doctor. Sometimes adjusting the dose, switching to an alternative, or adding a stomach protector is enough to drastically reduce that persistent phlegm. Polypharmacy, the simultaneous use of several medications, is extremely common among older adults, and interactions can become complicated. That's why having a conversation with your physician and exploring options can make a huge difference. Your throat will be grateful, believe me. Now let's move on to another important cause. The air you breathe and the smoke we often forget is around us. This is a key environmental factor and, surprisingly, one of the most underestimated ones. I'm referring not only to smoking and vaping, but also to everyday irritants like wood-burning stoves, household cleaning sprays, environmental pollution, and even microscopic dust such as PM 2.5, which can infiltrate any space. All these irritants significantly affect the respiratory tract. They activate mast cells, which release inflammatory substances, and more importantly, they damage the cilia, those tiny microscopic hairs that line the trachea and bronchi. Cilia work like a synchronized choreography that moves mucus outward. But by age 50, and especially after exposure to irritants, those cilia no longer function with the same efficiency. The mucus then remains stuck, motionless, unable to move out. If you smoke, I want to suggest a very simple but eye-opening exercise. Calculate how many cigarettes you consume in a year. If you smoke 20 a day for 40 years, that adds up to around 8,000 cigarettes. Each puff paralyzes the cilia in your airways for about 45 minutes. Do the math and you'll understand that this is a constant aggression that, over time, destroys your body's natural ability to clean itself. And even though vaping is promoted as a safer alternative, it also introduces irritating chemicals that can generate a similar effect in the lungs. To this, we must add a silent accomplice: dehydration. When we drink less than 1.5 liters of liquid per day, something far more common than most people realize, our mucus becomes thick, dense, almost like caramel. And for cilia that are already weakened, moving that kind of mucus becomes nearly impossible. Older adults must maintain proper hydration. A practical guideline is to drink about 30 milliliters of liquid per kilogram of body weight. So, if you weigh around 70 kilos, you need a little more than 2 liters per day. It's not only water that counts. Herbal teas, soups, fruits, and vegetables also contribute to hydration throughout the day. Your mucus needs to be well hydrated to fulfill its protective function and, more importantly, to allow your body to clear it without effort. Now, it's important to understand when it's truly necessary to see a doctor. We've talked about common and manageable causes, but I must also warn you, based on my medical experience, that there are signs that should never be ignored. Although persistent phlegm is often a benign problem, sometimes it reflects something more serious. That's why I ask you to pay close attention to these warning signs. If the phlegm has an unpleasant odor, a strong rotten smell that is not typical of normal mucus, this may indicate a deeper bacterial infection, such as severe bronchitis or even a significant lung infection. And if you ever notice streaks of blood mixed with the mucus, do not overlook it. Sometimes a little blood may appear due to constant throat clearing, but even so, the presence of blood should never be taken lightly. It may be a sign of a more serious infection, bronchiectasis, which are abnormal dilations of the bronchi, or, in rare cases, a tumor, something that must always be ruled out. Another important sign is a fever of 38 degrees Celsius or higher, especially if it comes with chills or general discomfort. This often indicates an active infection that requires medical evaluation. And if you notice that you're losing weight without changing your diet, if your clothes start to feel looser for no reason, that is also an alert sign. Unintentional weight loss may be linked to chronic diseases, serious infections, or even neoplastic conditions. Finally, I want to explain the 15-day rule. If after applying all the recommendations I mention in this video the phlegm continues for more than 2 weeks without any improvement, it's time to move to the next step. Schedule a medical appointment. A bronchoscopy may be necessary to examine the inside of your airways, or at least a chest X-ray, and even a CT scan, to rule out pulmonary conditions that have not yet been identified. Do not self-medicate, but do not ignore the symptoms either. Listen to your body and act responsibly. Your health is your most valuable treasure. Before we continue with the solutions that truly work, let me ask you a simple question. If this content is helping you understand what is happening inside your body, if you feel that moment of clarity where everything begins to make sense, I invite you to subscribe to the channel and activate the notification bell. I upload new videos every day to guide you and offer practical tools that support your well-being. And by sharing this video, you help others who live with this same discomfort find relief. Recently, I treated a patient named Gilberto who had been dealing with constant phlegm for months. He thought it was just a normal part of aging, but when he followed the recommendations and went to his medical checkup, we discovered a severe reflux condition and an infection that had gone undetected. Thanks to timely diagnosis, his quality of life changed completely. I mention this because many times the difference between a temporary nuisance and something more serious is simply asking for help at the right moment. And now, let's move to what can truly help you starting today. After understanding the causes, we move on to the solutions. The best part is that many of them can be applied immediately, without prescriptions and without major expenses. These are simple but highly effective habits that can transform the health of your throat. Let's begin with smart hydration, the real elixir to keep your mucosa in good condition. It's not just about drinking water, but doing it with intention. Start your morning with 2 glasses of warm water on an empty stomach. This not only hydrates your body but also activates your digestive system and helps dissolve and mobilize the mucus accumulated overnight. And before going to bed, drink another glass of warm water. Why warm? Because cold water can constrict blood vessels and slow down absorption. If you are taking diuretics, add a pinch of sea salt, not refined table salt, to one of your daily glasses. Diuretics may cause the loss of electrolytes, especially potassium, and sea salt provides essential minerals that help balance the body. Think of water as your internal lubricant. Without it, everything begins to jam. Now let's talk about nighttime elevation. Gravity can become your best ally in fighting silent reflux. Adding an extra pillow is not enough, as it often only bends the neck. The ideal solution is to elevate the head of the bed by placing a 10 to 15 centimeter block under the legs. That gentle incline prevents acid from rising into the throat while you sleep. If elevating the bed is not possible, a wedge pillow that raises your entire torso is an excellent alternative. Another useful tool is nasal irrigation, essentially an internal shower for your sinuses. The mixture is simple: 250 milliliters of boiled and cooled water, 1 teaspoon of sea salt or non-iodized salt, and 1 teaspoon of baking soda. The baking soda helps neutralize acidity and loosen mucus. Use a nasal rinser or a neti pot to apply it, but if you don't have one, a cup and your hand will work. The technique is key. Lean over the sink, tilt your head, and let the solution flow gently through one nostril and out the other. Do this for 5 seconds on each side, morning and night. This reduces inflammation, removes irritating particles, and improves mucus mobility. And finally, let's talk about one of the most overlooked tools, a cool mist humidifier. Dry air is one of the biggest enemies of thin, movable mucus. Having a humidifier in your bedroom can bring enormous relief, especially during dry seasons or if you use heating or air conditioning. Moist air helps keep mucus softer and easier to clear. But there is an important warning. You must clean the humidifier tank every 3 days using white vinegar. If you do not, it becomes the perfect environment for mold and bacteria to grow. A humidifier that is not cleaned properly can make your symptoms significantly worse. Another habit you need to break is throat clearing. It creates a cycle of constant irritation. Even if it feels like it gives temporary relief, it is actually very harmful. Every time you clear your throat, it is like rubbing sandpaper on your vocal cords. That friction causes irritation and inflammation, and the body responds by producing even more mucus. It becomes a vicious cycle with no end. Instead, whenever you feel the urge to clear your throat, try a gentle cough with your mouth slightly open, or take a small sip of water. Both actions lubricate the throat and help you move the mucus without damaging tissue. Now let's talk about your diet. What you eat plays a decisive role. Your last meal of the day should be at least 3 hours before going to bed. Giving your digestive system that time reduces the risk of nighttime reflux. It is also essential to identify and avoid foods that trigger these episodes. Foods like tomatoes, chocolate, mint, fatty meals, spicy dishes, acidic foods, and especially coffee after 6 in the evening can all increase reflux. Caffeine relaxes the lower esophageal sphincter, allowing acid to rise into the throat. Another powerful recommendation is a swallowing exercise. These movements strengthen the internal muscles involved in swallowing, which naturally weaken over time. After brushing your teeth, perform this simple exercise. Swallow your saliva consciously 10 times, focusing on the movement. This tones the throat muscles and helps the lymphatic system drain fluids and mucus. It is a small habit with a surprisingly meaningful impact. Regarding supplements, N-acetylcysteine can be a helpful tool to thin mucus. I always insist that you consult your doctor first, especially if you have asthma or a history of ulcers. A dose of 500 milligrams, taken half an hour before a meal or 1 hour after lunch, can make a noticeable difference. N-acetylcysteine is a powerful mucolytic. It breaks the molecular bonds of mucus so it becomes more liquid and easier to clear. It works as an extra support that enhances hydration and nasal irrigation. Now let's discuss the remedies that do not work and why they do not work. There are very popular myths that, besides being useless, can actually make the problem worse. The most common one is mixing sugar with lemon. Many people believe it is good for the throat, but the reality is the complete opposite. Sugar acts as a dehydrating agent. Through osmosis, it pulls water out of the cells in your throat, leaving the tissue dry, irritated, and producing even thicker mucus. It is like trying to put out a fire with gasoline. Avoid it. Another popular belief is that milk produces mucus. Scientifically, milk does not create new mucus. However, casein, one of its proteins, can make some people feel like their existing mucus becomes thicker, especially if they are dehydrated or sensitive to dairy. It does not create more mucus, it thickens what is already there. If you notice this effect, reduce dairy for a while and observe any changes. And let's talk about expectorant syrups with guaifenesin, which are extremely common. It is true that guaifenesin is a mild mucolytic that helps thin mucus. But here is the truth. If you are not properly hydrated, these syrups only turn your mucus into an expensive gel. They are not magic. They require a well-hydrated body to work. Without enough water, their effect is minimal and the mucus will continue to bother you. So the next time you hear quick solutions, remember what I just explained. The key is never in instant fixes but in understanding how your body works and following strategies supported by science and common sense. At this point, we have already covered half the journey to getting rid of persistent mucus. If you are finding this information helpful, it would mean a lot if you type "yes" in the comments. I am preparing a practical guide with all these recommendations in a printable chart you can place on your refrigerator for easy access. And your engagement helps YouTube share this content with more older adults who, just like you, have lived for years with the discomfort of constant throat clearing. Let me share a real story that perfectly illustrates what I am explaining. It is the case of Mrs. Rosa, a 68-year-old woman who came to my clinic feeling frustrated and exhausted. She had been suffering for 8 months with what she described as a never-ending cold. She had tried home remedies, honey with ginger, and even an antibiotic prescribed by another doctor for 3 weeks, but nothing gave her lasting relief. Her quality of life was deeply affected. Speaking was difficult, she felt constant discomfort, and the dry cough kept her awake at night. When I examined her, the first thing we performed was a nasofibroscopy, a simple procedure where we use a thin fiber optic camera to look directly at the throat. What I saw is something I unfortunately find often: an irritated, reddened throat, swollen vocal folds, and most importantly, a drop of thick, sticky mucus exactly in the area she kept pointing to. Based on the examination and her history, the diagnosis was clear. Mrs. Rosa had a combination of silent laryngopharyngeal reflux and postnasal drip caused by chronic maxillary sinusitis that did not produce headaches, only congestion. We also discovered she was taking an anti-inflammatory medication for her knee that was contributing to the reflux without her knowing. The plan I designed for her was comprehensive and fully personalized. The first step was stopping the anti-inflammatory medications she was taking and replacing them with an option that would not irritate her stomach. Then I recommended a simple but incredibly effective adjustment, lowering her pillow to about 2 centimeters so her head would not bend so much during the night, allowing for better nasal drainage. I also instructed her to perform nasal rinses with saline solution, emphasizing proper technique, and I prescribed N-acetylcysteine to help thin the mucus. 21 days later, I received a message that truly made my day. "Doctor," she wrote, "for the first time in months, I woke up without that cough that made me feel so old. My throat feels clear." Dona Rosa recovered her voice, her comfort, and most importantly, her sense of hope. Her story carries a powerful lesson that summarizes everything I want you to take from this video. Identify the real cause. Do not limit yourself to fighting the symptom. Phlegm is not a disease, it is a message from your body. Listen to it. Look for the root of the problem. Many times, the solution is much closer than you might think. Before we continue, I want to invite you to something simple. If this content is helping you understand your health and you feel you are finding clarity and answers you hadn't received elsewhere, I encourage you to subscribe to the channel, activate the notification bell, and share this video. I upload new content every day designed to guide you in a practical and human way. Your support helps more people find relief. Now, let's move into a section that always brings questions during consultations. These are concerns I hear repeatedly about persistent phlegm, and today I want to clarify them so you can finally understand what is happening. Does ginger help? Ginger is an extraordinary root with anti-inflammatory and antioxidant properties. It can soothe throat irritation and offer a sense of comfort. But does it liquefy mucus or make it thinner? It does not have a direct mucolytic effect. Use it in teas to calm the throat, but do not expect it to be the definitive solution for thick phlegm. It is supportive, not a primary treatment. What about turmeric? Turmeric is another powerful anti-inflammatory root, widely studied for its health benefits. However, its active compound, curcumin, has a major drawback. It is absorbed very poorly when consumed alone. To work effectively, it must be combined with piperine, the compound found in black pepper. Without piperine, absorption is minimal, and so is its anti-inflammatory effect on the throat. Like ginger, it can be calming, but it does not work as a mucolytic. What if I have high blood pressure? If you have hypertension, most of the recommendations discussed today are completely safe. Nasal rinses with salt and bicarbonate do not alter blood pressure because almost no salt is absorbed. Elevating the head of your bed can even be beneficial by improving nighttime breathing and helping stabilize blood pressure in some cases. As for N-acetylcysteine, although generally safe, you should consult your cardiologist or nephrologist if you have heart or kidney disease, since any supplement should be evaluated carefully in these situations. Prudence is essential. Another common question: what if I am already taking omeprazole? Many patients with persistent phlegm come to my office already using omeprazole or another proton pump inhibitor to control acid reflux. If you are one of them, there is no issue with continuing it, but it is important to evaluate whether you have been taking it for more than 4 months without recent medical supervision. The FDA recommends a limit of 14 consecutive days without oversight due to potential long-term side effects. It can reduce calcium and vitamin B12 absorption, increase the risk of intestinal infections, and cause rebound acidity if stopped abruptly. If your phlegm persists despite using omeprazole, it may mean reflux is not the main cause, or that your dosage and timing need adjustment. Consult your doctor. It may require changes or a different approach. Now I want to give you a practical tool, a mini checkup you can do right now to start identifying what is causing your persistent phlegm. For silent reflux, LPR, ask yourself honestly: do you clear your throat more when you wake up or after talking for a long time? Do you taste bitterness, acidity, or metal in your mouth, especially in the morning? Do you feel a lump or something stuck in your throat that does not go away? Does your voice tire easily or break when singing in the shower? Do you experience dry cough or the need to clear your throat after eating or bending forward? If you answered yes to 2 or more, silent reflux is likely contributing to your phlegm. For postnasal drip or sinusitis, do you feel liquid dripping down the back of your throat, especially when lying down or waking up? Do you wake up congested or needing to blow your nose even without a cold? Do you feel pressure in your cheeks or forehead when leaning forward? Have you had long-lasting colds or congestion that never seems to fully go away? 2 or more, yes, answers suggests chronic sinusitis or postnasal drip could be the main cause. For environmental irritants or dehydration, do you smoke more than 10 cigarettes a day or vape regularly? Do you wake up coughing with a tobacco taste or extreme dryness in your mouth? Do you live or work around dust, chemicals, smoke, wood stoves, or heavy traffic? Do you drink less than 1.5 liters of liquids per day or have dark yellow urine? Even 1, yes, gives us important clues. And if you smoke or vape, that alone is a clear red flag. This mini checkup does not replace a medical evaluation, but it gives you a solid direction to understand what is happening and helps you make informed decisions. Now let's move on to the 72-hour plan to get started today. A small personal experiment you can begin immediately that will show you exactly where the problem may be coming from. Be consistent and observe how your body responds. Day 1. The start of the cleanse. When you wake up, grab your bottle of saline solution or prepare your nasal rinse at home. Throughout the day, aim to drink at least 2 liters of warm water in small amounts. Start with 2 glasses on an empty stomach and continue hydrating until night. Before going to bed, do your first nasal rinse. And here's something essential: sleep with the upper part of your bed slightly elevated. You can place blocks under the legs or use a wedge pillow. Also make sure to eat a light dinner and always leave at least 3 hours between your last meal and bedtime. Day 2. Strengthening the habit. Hydration. Increase your liquid intake to 2.5 liters a day, including water, caffeine-free infusions, or light broths. In your diet, remove coffee after lunch and replace it with warm chamomile or unsweetened ginger tea. Avoid anything you know triggers irritation or causes reflux. Continue with nasal rinses in the morning and at night, and keep sleeping with your head elevated. Include throat muscle exercises right after brushing your teeth. If you have a humidifier, make sure it's clean and use it throughout the night. Day 3. Adding the final boost. Supplementation. If you have no medical restrictions and already discussed it with your doctor, you may add 500 milligrams of N-acetylcysteine after lunch. Awareness. Pay attention to your habit of clearing your throat. Whenever you feel the urge, avoid doing it. Instead, Take a small sip of water or use a soft, controlled cough. Observe carefully. Do you notice changes in the texture of the mucus? Has the frequency of needing to clear your throat decreased? Let me also share a very brief story about a patient I treated recently. Mr. Hector, a 63-year-old man, spent months waking up with a hoarse voice and that sticky sensation that didn't even let him enjoy breakfast. He started this same 3-day plan, and I remember that on the third morning he wrote to me, "Doctor, it feels like my throat can finally breathe." It wasn't magic, it was consistency. And believe me, you can achieve the same. If on the 4th day, after following the plan strictly, you notice no improvement or even worsening symptoms, it's time to request a more detailed evaluation. An ENT specialist or an internist may recommend a throat endoscopy or a CT scan of the paranasal sinuses to identify the exact cause. Don't get discouraged. This simply means the root of the problem needs a deeper assessment. If you've made it to this point in the video, it's because you truly want to leave behind this exhausting discomfort, and I'm genuinely glad for that. And since we're talking about improving your health, let me invite you to subscribe to this channel, activate the notification bell, and share this content. We upload new videos every single day, and I'm certain many of them can help you feel better. Thank you for supporting this community. I also kindly ask you to share this video in that WhatsApp group where you know family or friends are dealing with the same issue. And please leave your experience, questions, or concerns in the comments below. I personally read and respond to comments within the first 24 hours. This space is something we build together. Persistent phlegm is not a punishment, nor an unavoidable consequence of aging. It's a warning sign, a signal that something, perhaps silent reflux, a sinus infection that never fully healed, a medication you're taking, or even the environment you live in, is disrupting your natural defense system. The good news is that once we identify the cause, we can act. You don't have to get used to living with that daily discomfort. If you find the root of the problem and apply these practical recommendations, I assure you that within a few weeks you'll be singing in the shower again without effort, having conversations without interruptions, and laughing freely. Health, at its core, is learning to listen to what the body whispers. Your throat is speaking to you. Don't ignore it. Take care of it. Before I say goodbye, I want to offer you a heartfelt invitation. Let's give thanks to God for life, for the opportunity to learn, and for the chance to discover tools that improve our health. Every day we're able to breathe, move, and understand more about our body is a tremendous gift. And if you haven't yet, I invite you once again to subscribe, activate the bell, and join this growing community. Here you will find trustworthy, clear information designed especially for you. I'm Dr. Gabriel Mina, and I wish you a light throat, a free voice, and a full life, without that mucus that has taken away your peace for so long. I'll see you in the next video. I'll be here tomorrow with a new topic for your well-being.